Got sciatic pain? Pain shooting down the back of your leg? Hi, this is Dr. Evan Osar with the Integrative Movement Institute. Hope you're having a great week. Happy Tuesday to you. Thank you for being part of our community and joining us in this video. Many of your clients, especially your older clients, will present with a condition known as sciatica. Now, sciatica can have different origins based upon what's causing it. So I want to share 3 common causes of sciatica. A couple of them, you can do some easy corrective exercises to address them specifically. Others, you need the help of a manual therapist, a qualified, licensed manual therapist like a chiropractor or physical therapy or massage therapist, or a diagnosis from a medical professional. So one of the most common causes of sciatica, that pain in the low back or maybe the glutes or I should say, or pain shooting down the leg, is coming from the low back. The nerves out of the low back come down and innervate the muscles of the lower extremity as well as all the way down to the foot. The sciatic nerve is combined of those nerves from about L4 through the bottom of the sacrum and that last coccygeal nerve. They sort of form this sciatic nerve. The sciatic nerve is quite thick, maybe the size of, or the thickness of a pencil. Some people's may be larger, some people's may be around that size, but it runs down and out around the pelvis. So if you actually put your hands around the pelvis, so the front and back side of your pelvis, you slide down and towards your sacrum until you feel your tailbone. So my tailbone is right about there. And if you move over a couple inches, so sort of like right here, looks good like poking my butt on camera. The sciatic nerve is somewhere exiting the greater sciatic foramen or notch in that pelvis. Then it goes underneath, or I should say, sort of underneath the piriformis, so that muscle running across from the sacrum out here to your greater trochanter. So it's running underneath the piriformis. Some people it divides and goes over top of it, but for most of us, it's underneath the piriformis. Then it runs down the back of the leg, and it sort of runs on the outside of the thigh here, the posterior thigh, underneath the biceps femoris. It's sort of in between the 2 halves of the hamstrings, the medial and lateral hamstrings, but it's sort of more underneath the lateral hamstrings or that biceps femoris. And then around the knee, it splits into 2 nerves, the tibial nerve, which goes to the back of the leg, innervates the back of the leg and the bottom of the foot, and the common peroneal nerve, which if you put your hand right here on the outside of your knee, you'll feel that little notch, your fibular head. The common peroneal nerve is that nerve that sometimes you bang on or you can actually feel right there. That goes down to innervate the front of the lower leg and foot as well. Now, so one common cause of sciatica is if you irritate those nerves, like if you have a disc herniation and it hits one of those branches that makes and forms the sciatic nerve, you can have nerve pain shooting down. That's typically what sciatica is, nerve pain, and it can also be associated with loss of sensation or heightened sensation because the nerve is irritated, and or the loss of muscle function. The muscles they function weakly, or they test weaker than they normally should be, or compared to the other side. So the first cause, disc herniations. Now, if it's a disc herniation issue, generally speaking, this is not for everyone. It responds well to going into extension. So more extension of the spine will allow you to address disc herniations that respond to extension bias positions. Many of our clients sit for a living, sit for a good portion of their day. Many of us sit for a good portion of our day. So flexion starts to create more irritation. So extension can be a relieving position and take some of that disc pressure off that nerve. So that's one common cause. Now, in our older clients, many of you work with older clients like we do in our clinic, then we are dealing with an issue called spinal stenosis. You've heard me talk about, refer to that quite a bit here in our video series. So spinal stenosis, generally you'll see your clients more in this position, posterior pelvic tilt, lumbar spine flexion, thorax in increased flexion, and often positioned behind the pelvis. Now for those clients, you don't want to bring them into extension because what they're trying to do with that flexed spine position and that flexed pelvis position is to increase the space of spinal compression, usually from degenerative changes, bone spurs, lack of disc height, So there's compression on the nerves. They can also have pain shooting down their lower leg. Could be bilateral. It tends to be a bit more unilateral. It's more significant on one side. The strategy for those individuals is you have to do something to get them more elongated and to create space. One of the best strategies for that is three-dimensional breathing. Doing myofascial release around the lumbar spine, the quadratus lumborum, maybe the glutes, teaching them how to three-dimensionally breathe so they can actually lift their rib cage up off their pelvis. So three-dimensional breathing is the go-to exercise for your clients that have sciatica, because most of them are braced down, they're compressing themselves down because they're trying to avoid pain. So three-dimensional breathing is a strategy to help relieve, to create space, and to create the rib cage lifting up and off the pelvis. I'll show you that here in a moment. Now, the third cause of sciatica can be what's happening around here. You've heard of piriformis syndrome. Piriformis syndrome is essentially where the piriformis is tightened down and compresses that space where that sciatic nerve is coming out. Well, there's another muscle that comes up underneath here and attaches to the sacrotuberous ligament. Sacro means it's coming off the sacrum, the lateral edge of the sacrum. Tuberous means it's attaching to the ischial tuberosity of the pelvis. So again, sounds complicated, but if you actually follow the anatomy, oftentimes it tells you exactly where it is. So it's this ligament. If you take your hand, feel the outside edge of your sacrum. Now slide down, so just where it kind of goes towards your tailbone. And if you feel in this space right here, again, you're not going to do this out in front of your friends. Maybe you will because you're that kind of person. But if you rub back and forth here, you'll feel that ropey fiber. It almost feels like a bone because that's how dense that ligament is. Because you have your hamstrings coming up to attach into that ligament. That ligament is also helping to hold your sacroiliac joint and stabilize your sacroiliac joint. So it's a very thick, dense ligament. It could be tender, it may be tender. Well, if your hamstring is short and tight, which it often is in our clients, and is pulling down on your ischial tuberosity and that ligament, it can create some compression and pull on that sciatic nerve. So that's an uncommon cause. However, we see it all the time in our office because so many of our older clients, again, many of our younger clients too, it's not just older clients, they're stuck in that posterior pelvic tilt position. And then if they do exercises, like they're doing squats, and when they come up, they keep thrusting themselves forward like this. If they're doing, abdominal exercise and they're really crunching themselves down, they keep shortening down their abdominals and their hamstrings, pulling themselves into further posterior pelvic tilt. Then they go sit, they're sitting in posterior pelvic tilt. So now you can see how that can create a chronic shortening of the hamstrings. So a quick, easy thing you can do is do myofascial release on the hamstrings. So you can just use a device, got a little trusting activator here. You can use this device right here and just do a little bit of myofascial release along the glutes. And you can't really get to the sacrotuberous ligament with a device like this. You could sit on it, but again, you don't want to sit on it completely because your tailbone is quite sensitive there, and there's not a lot of space there, so you may irritate the tailbone and or shift the tailbone more than you're actually releasing that sacrotuberous ligament or the attachment of the hamstrings. So you could use this, do some myofascial release, self-myofascial release here. You can obviously take it down the lateral hamstring to release the lateral hamstring as well. So that can help create a myofascial release of the lateral hamstring. Now, a nice way to lengthen it, you see me do this, but I'll show it again, is you can have your client have a seat on the edge of a chair, such as this. A higher chair is generally better for most of your clients. They can bring that one leg out, square the pelvis to that leg, and then do a small hinge forward. And as long as it's not recreating their sciatic pain, this becomes a very good way to lengthen the hamstring and also give a gentle stretch, so to speak, a neural sort of glide to that sciatic nerve. Now, if you'll notice here, I'm keeping myself in a bit of spinal extension, so that way you're not here and here, where now you're stretching that nerve around the low back. So let me give you another visual for that. So what you don't want to do when you're gliding nerves, because nerves can get stuck just like any tissue can get stuck, is what you don't want to do is necessarily, imagine this is my sciatic nerve here, you don't want to stretch it at down here and also stretch it here by doing this kind of stretch. What you would do is you would extend your spine, shorten it through spine, and then lengthen it here. So that way you're almost doing more of a nerve flossing versus a pure nerve stretching. So you don't want to stretch it at both ends so that way you can help it glide through the sheath or the area where that sciatic nerve travels. Okay? So again, have a seat, get up on the ischial tuberosities, little bit, small amount of spinal extension, leg comes out, then do a small hinge, nice and slow, just a series of 5 hip hinges, just nice and easy, as long as there's no recreation of their sciatic pain or pain down their leg. They're able to do this very easily. It doesn't have to be a huge motion. And it's a great way to mobilize the sciatic nerve. And again, you can also train it in a more upright position, maintain that nice curve of the spine, do a small hip hinge, so that way, again, mobilizing that sciatic nerve over the hip here, or around the hip, as long as it's not recreating your client's issues. So I hope you enjoyed that video. I hope it made sense. Sciatica is a very common issue. 3 common areas of entrapment can be, or I should say irritation, can be from the disc herniation from the lumbar spine. It can be from spinal stenosis and degenerative changes around the low back. It can be from even short muscles like the piriformis and or the glutes and or those hamstrings that are attaching up into the ischial tuberosity underneath where the sciatic nerve is coming out. One of the best strategies, the go-to exercise, is breathing, 3-dimensional breathing, so that you send your breath down in this direction, which helps to lift the ribcage up off the pelvis to create more space for those nerves to exit. And it also helps to relax the nervous system. So if you have a nerve that's been irritated, like the sciatic nerve has been irritated, it's a great way to decrease just that overall sympathetic sort of upregulation that happens with sciatica and nerve type issues like that. And then finally, make sure if you do self-manual release, self-myofascial release, and or manual release, make sure you're appropriate, work within the scope of practice, use the appropriate technique so you're not irritating the nerve, and you can create that release that frees up that sciatic nerve, and then just train your client in a bit more neutral position so that they're able to control that position. And that's a great way, a great strategy to help your clients with sciatic pain and help progress them, in addition to the things that their doctor, their physical therapist, or chiropractor are having them do as well. And that's how you become the go-to specialist for your current clients and attract more individuals that need, want, and will pay you for your expertise. This Saturday on Two Anatomy Geeks, we have part 3 of our 3-part series on anatomy of the nervous system, as well as how to use this information to create more optimal strategies for your clients that have nerve-related issues, like sciatica. We'll be talking more in depth about sciatica this Saturday. We'll also be talking about thoracic outlet syndrome, or entrapment of the brachial plexus as it comes out of the neck, goes underneath the collarbone and down the shoulder, and why so many of your clients have scapular winning and issues with their shoulder tightness, chronic neck tightness. We'll address the thoracic outlet, the brachial plexus issue as well, and give you strategies for that as well. The link is below or next to this video wherever you're watching it. And even if you missed the first 2 parts and or can't join us Saturday, they're all recorded. You'll get sent links to that as soon as you enroll to watch the first 2 parts. And we hope to join you, or have you join you, yes, and have you join us on Saturday on Two Anatomy Geeks. It's really a fun, interactive community. It's a great community of positive fitness professionals, healthy fitness professionals, just like you. They're out there looking to make a difference and support each other. And that's what we really love this community. Jill and I created this community over 2 years ago now, or almost 2 years ago, during the start of the pandemic in 2020. I can't believe it's almost 2 years. And it's really a great way for those of us that felt sort of isolated to come together to learn anatomy, how it applies to our training, to create more optimal results for our clients and more outstanding results from our clients. And again, to support each other. It's really, like I said, it's one of my favorite things that we do here at IMI, and it's a great community. Many of you on here, Kate, I see you. Hey, how are you? Thanks for being on. It's a great way, Rahul's on as well. It's a great way to support each other. Sue Gleason as well as part of our community as well. It's a great way to support each other and just in a positive environment. So we'd love to have you join us. Link is below. It's only $69 for about 6 5 to 6 hours of content. Like I said, they're all recorded. You have access to the recordings for as long as we're around. You have access to the handouts, and we'll get CCs once the program is over. So check it out. If you have any questions, put them below this video, and we'll look forward to seeing you. This is Dr. Evan Osar with Integrative Movement and Sciatic. Make it a great day. Get out there and lead. Be that shining example for your clients and your potential clients that need someone just like you. Take care.